Some symptoms of back issues: muscle aches and pains, just general in the muscle area that don't radiate elsewhere. Shooting, stabbing across the back can occur with just general back pain going across there. If there's arthritis or anything like that, that can just cause some tightness going along those muscles, which are trying to respond to the pain going inside the joint of the spine. Pain that radiates down the leg, either above or below the knee. You can have numbness and tingling, as well as the pain, as well as weakness. And as those symptoms get worse, you'll actually notice that you'll have more leg pain and not even possibly any back pain. So that's kind of confusing for some people, because a lot of times we see patients that come in and they say their leg hurts, but then we have to explain to them that because of the nerve compression going on in the back, the pain in the leg is actually coming from the back. You will also find that you'll have pain in various positions, whether it's prolonged sitting, prolonged standing, or prolonged walking. How does this impact your life? It can impact your life on so many different levels. So you can't stay in one position for too long. You have to change positions pretty often. You can sometimes get pain trying to get comfortable at night, and then when you finally get comfortable at night, if you tend to move in your sleep, then you might get pain that wakes you up at night. Taking a shower or getting dressed, trying to pull your leg up, trying to bend over to put your shoes on, it might actually cause pain. You may find it difficult to negotiate stairs or even walk distances greater than about 5 to 10 minutes, because if there's weakness, then your knee might start to buckle. And then also your foot could actually have something called foot drop, and that pretty much means your foot kind of slaps down onto the surface as you're walking because there's no muscle control. Also, recreational activities. I mean, if you can't do these different movements because of either weakness or pain, then you're not going to be able to participate in any of your recreational activities. Generally speaking, a lot of people with back pain kind of wait and see what happens. And in most cases, the back pain should kind of go away within a few weeks. However, within that 4 to 6 weeks, if you notice that the pain in your back is getting worse, and or now you have leg pain that you didn't have before, numbness and tingling in your leg, that's something you should definitely address. Any knee buckling or weakness in the ankles from walking. Also, if you've experienced a fall, that's something you shouldn't wait and see about. You should definitely get checked with that immediately. How does physical therapy help? Physical therapy helps a ton when it comes to back issues. Most of the time, patients can get help immediately and should seek help immediately when they have back pain, because even if you wait and see, and yes, it does get better, we can actually help it get better a lot quicker. There are pretty standard exercises for certain issues in the back. However, there's lots of times I've had people come in that I expect them not to respond well to certain exercises based on their diagnosis. However, when I try them, they actually respond well. The other thing is stretching, just tight muscles, working on those things. Strengthening is huge with physical therapy when it comes to the back, because we tend to use the back muscles a lot more, and we have weakness in our abdominals and our hip muscles. So with physical therapy, we can strengthen all those things, and when we strengthen all those things, that gives your back support that it didn't have before, because it was relying either too much on the joints themselves, the vertebrae with the discs, and or the muscles in the back, but not using the front muscles in the abdomen and the hip to kind of counterbalance all that's going on in the back to take the pressure off. A lot of people are sitting at a desk for many hours a day. So we are very involved with figuring out ways to maneuver patients' work setups, providing more ergonomic education so that they can have a better work setup, which will then lead to the ability to actually be more productive at work. And then also home exercise program. We get a lot of people that come in here that use Google and try to look up things to do on their own. I get that, but also you need a physical therapist to teach you properly how to perform the exercise. Is that exercise even really good for you to do personally? Having someone there to teach you those things and actually have hands-on with you is extremely important to ensure that you're doing everything properly and that they're progressed accordingly. So if you're interested in learning more about back pain and how we can help you, you can call the number below or click the link below.